All right, welcome back everyone to part 13 of our 100-part CPC exam series. I'm your host, and today we are mapping out the absolute high-yield zones of the sensory organs, specifically the eye and the ear. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. Okay, let's dive right into this explainer. So you might be wondering, why does detailed sensory anatomy drive your code selection? Well, 'cause in sensory coding, the details are literally everything. Knowing the exact difference between structures like the cornea and retina, or say the tympanic membrane and cochlea, is the critical trigger for choosing the correct CPT or ICD-10 code. Without the exact anatomy, you just can't code the pathology or the surgical fix accurately. It's really that simple. Here is our quick agenda for today. We'll be covering decoding sensory anatomy, eye anatomy and function, eye conditions and procedures, ear anatomy and pathologies, high-yield ear procedures, and finally, the sensory cheat sheet. Let's kick things off with Section 1, Decoding Sensory Anatomy. This right here, this is the golden rule of cause and effect in medical coding. The specific anatomical structure dictates the pathology, which directly dictates the surgical fix, leading you right to your final code. Visualizing how these sensory organs are compartmentalized is absolutely crucial. It's the secret to not losing easy points on exam day just because of anatomical confusion. Moving right along to Section 2, Eye Anatomy and Function. Think of the eye like a camera. Actually, scratch that. Think of it as a highly advanced organic camera. The cornea is your clear front window refracting light. So if a patient chart mentions surface issues, you look here. The lens focuses that light, and when it clouds over, we code for cataracts. The retina is basically the camera's film, packing photoreceptors that are vulnerable to macular degeneration. And the optic nerve, that's the cable sending the image to the brain, which is exactly where glaucoma strikes. You also really need to spot the sclera and the iris. The sclera is that outer white protective layer, and the iris is the colored portion regulating light. Treat these as your foundational anatomical landmarks, They're keywords you are going to constantly scan for in complex operative notes. Okay, Section 3, Eye Conditions and Procedures. So what does this all mean clinically? A cataract is the clouding of the eye's natural lens. Because it specifically affects the lens, the surgical procedure must involve extraction of that exact structure. It's a textbook example of anatomy dictating the surgical code. Now listen up, because this is a massive CPC exam trap for high-yield procedures. Intraocular lens, or IOL insertion. It is typically included in cataract extraction codes unless explicitly stated otherwise. Do not code it separately. You'll also see LASIK and blepharopathy on the exam, which is just eyelid repair. And keep your diagnostic code differences straight here. Glaucoma targets the optic nerve deep in the eye, while conjunctivitis is strictly a surface issue. They require completely different diagnostic code sets because they hit entirely different anatomical depths. Shifting gears to Section 4, Ear Anatomy and Pathologies. Much like the eye, anatomical depth is the whole shebang here. It's kind of like traveling down a tunnel. We start at the external ear, move into the middle ear, home to the tympanic membrane and ossicles, and finally reach the deep inner ear where the cochlea lives. You've got to memorize this spatial map. Linking these pathologies to their anatomical homes is basically like sorting them into their correct rooms. Otitis media sits right in that middle ear space we just mapped out. Tinnitus, or ringing, and Meniere's disease, those are conditions affecting the inner ear's balance and hearing functions. Which brings us to Section 5, High-Yield Ear Procedures. Okay, lean in for this one because it is one of the most common coding traps on the APC exam. A myringotomy is simply a surgical incision of the tympanic membrane. Just a cut. But a tympanostomy definitively requires the physical placement of a tube. If there's a tube, it is a tympanostomy for sure. Please don't let them trick you on this. To wrap up the surgical ear codes, you absolutely gotta add mastoidectomy to your radar. That's the removal of mastoid air cells. Because this is a major middle and inner ear procedure, you have to carefully parse the surgeon's operative note so you don't accidentally unbundle codes. And finally, Section 6, the sensory cheat sheet. Let's lock in the absolute highest yield facts before test day. Remember your cornea, lens, and retina function map, structure equals function. Remember that cataract extraction inherently includes the IOL. And never, ever forget the golden rule. Myringotomy is just an incision, but tympanostomy means tubes. It's amazing how precisely our bodies are built, isn't it? But remember, as a coder, one single missed anatomical detail changes the code, alters the entire patient record, and directly impacts reimbursement. Will you let a single missed detail cost you your certification? Keep studying hard to ensure you don't. Coming up in Part 14, we're shifting from sensory organs to our body's complex defense systems as we tackle hematologic, lymphatic, and immune coding. I'll see you in the next explainer.